Hi Pete, what is QRISK?
Thank you for that question, Philip and Otis. So, QRISK is a tool that helps healthcare professionals assess someone's risk of a heart attack or stroke over the next 10 years. There's lots of these tools around, but QRISK was made using UK data, so it's the most appropriate tool for us to use here in the UK. It pulls a diverse set of data about a patient's health, lifestyle, and social factors like deprivation. Then it performs a complex calculation and presents this risk as a percentage score. The calculation is constantly tweaked by a team of experts, with bigger updates coming out every few years in response to newer evidence, and we're currently on QRISK 3, which includes even more conditions and characteristics which could increase someone's cardiovascular risk. The background calculation is quite sophisticated, but the easiest way to illustrate it is to work through an imaginary patient. For this example, let's call our patient something like Mr. Blobby. If we had Mr. Blobby in front of us, we would use aspects of his history and a series of questions to help us complete the online form on the QRISK 3 website, and this would give us his QRISK 3 score. When we calculate Mr. Blobby's QRISK, we're imagining ourselves following 100 exact clones of Mr. Blobby for the next 10 years. If his QRISK comes out at 5%, we would expect 5 out of the 100 Mr. Blobbies to suffer a heart attack or stroke over the next 10 years if they were to do nothing to improve or worsen their cardiovascular risk. If the risk is 10%, we would expect 10 of these Mr. Blobbies to suffer these events, and 20% would be 20 Mr. Blobbies, and so on. The first question Mr. Blobby would probably ask you after you calculate his QRISK would be, what can I do to reduce my QRISK score? But the sad truth with this score is the biggest contributor is age, and each year as someone gets older, their score will usually increase even if they make improvements in other parts of their cardiovascular health. This is because age is a non-modifiable risk factor. But thankfully, there's lots of modifiable risk factors for us to consider, like increases in exercise levels or improving diet. These all have a brilliant evidence base supporting their effectiveness, but unfortunately, even huge improvements in these areas won't really influence someone's QRISK score. The reason for this is that the QRISK score can't pull data about someone's exercise, diet, and sleeping patterns because these areas are quite difficult to measure and we just don't have data on them. This means that improvements in each of these areas can't be captured by the calculation. The main message I have for patients and clinicians about the QRISK is this is the starting point for the cardiovascular assessment, not the end point. You'll regularly encounter an apparent mismatch between someone's score and what you feel their cardiovascular risk is, and it's important we respond to this pragmatically. As part of this pragmatic response, we'll need to make a decision about whether we start drug treatment to help reduce someone's risk of heart attacks and strokes. There's several treatments available for this, but by far the most effective and widely used are the statins. There's a lot to be said about these treatments, so they will be covered in more detail in a later video, but these work by both reducing levels of bad cholesterol, called non-HDL, and some less well understood effects which are believed to keep the lining of the blood vessels healthy. These other effects are actually believed to play a bigger role in cardiovascular health than reducing the cholesterol levels, so we shouldn't exclude people from the treatment if their cholesterol levels are okay, but this can affect the starting dose we use. Statins have a brilliant evidence base and they're quite safe treatments if we approach them the right way. And usually, with a bit of trial and error, we can get one that just falls into the background of someone's life with little or no side effects. Returning ourselves to Mr. Blobby for a moment, the NICE guidance says that when we hit 10%, we should offer him the option of starting a statin. And after we hit 20%, this becomes a much stronger recommendation to start a statin. This is because if we were to get the QRISK 20% version of Mr. Blobby on a nice approved dose of a statin, 7 out of the 20 unfortunate Mr. Blobbies wouldn't have a heart attack or stroke in the next 10 years, even if they did nothing else to improve their cardiovascular health. These illustrations can be a great tool to help patients understand their score, but they actually don't have to involve Mr. Blobby. NICE have made these for other QRISK scores in an excellent decision tool for both patients and clinicians. I've included a link to this in the description, so I would strongly recommend sharing it with your patients to help them understand their risk. So there you have it. The QRISK calculator is a great tool for starting to look at your patient's cardiovascular risk. As I mentioned before, there's some important things it won't pick up, so let's have a look at those in the next video. See you next time.